This is how we do it on a Friday night. Okay, I'm not gonna keep singing for you guys, but I do wanna say Happy Friday, my fine friends. So thank you for hopping on, or thank you for catching the replay, because those of you that watch the replay are the only ones that are gonna see what just happened, to be completely honest with you. And I love my replay viewers and the comments that you guys leave me. You are completely awesome. So, in case we have not met before, because I share all of my videos publicly, my name is Dorothy Booth. I am a certified personal trainer, paleo health coach, a associate diabetes educator, a type 1 diabetic of 20 years. I am currently like 20 weeks pregnant. I'm not one of those warm and fuzzy moms, so don't ask. And I am here tonight to talk to you about type 1 diabetes, pregnancy, and low carbing, my experience with it, why I have chosen it. So if you know somebody that's low carbing or wants to low carb, if you have type 1 diabetes, if you're thinking about being pregnant, or if you are pregnant, or if you know people that fall into any of those categories, please share this with them, because it will be valuable information that they probably won't hear anywhere else. So first, because it is Friday and I like to keep things fun, and some of you don't know me very well, let's play Fun Fact Friday. Hi Jacqueline, thanks for getting on. We're gonna play Fun Fact Friday. So your job in this game is to leave at least one fun fact about yourself in the comments, because you guys are my tribe and I need to know a little more about you. Capiche? Okay, so I'm going to tell you a couple things about me, then we're going to get rolling with the fun stuff. Well, this is the fun stuff. That's kind of like the sciencey stuff. So, number one, I love to make people laugh, and I could probably do stand-up comedy. So you'll probably catch on to that while I do these live videos and the more and more you watch. Number two, I am super sarcastic, and a lot of people don't know how to read me. They don't know how to take me. People get offended by me. So don't be offended by me. Don't take certain things to heart. I just have a really twisted sense of sarcastic humor, and I'm actually really sensitive, and I care a lot about people, and sarcasm is my coping mechanism. The third thing, I love Jesus. The fourth thing, I curse a little, and Jesus knows that about me. If it offends you, I'm sorry. It's who I am. I hid who I was for a long time in fear of judgment of other people, and life's too short for that shit. That's how I feel. Number five, I love doing live video for you guys, and I wish someone would just pay me to do it. Really? Seriously? Maybe I should leave a tip jar? You think I should leave a tip jar? So I would do this all day. So that's all I have. Leave your fun fact below. So let's get rolling with tonight's topic, shall we? Okay, so low carbing. Why the hell do doctors freak out about low carb? I'll tell you why. It is because the American Diabetes Association says in their guidelines to eat a shit ton of carbs. Why do they say that? Because they deem low blood sugar more dangerous than high blood sugar. And yes, low blood sugar can be very scary. It can happen very abruptly. It can be crazy. But I will tell you that people that ride this high carb roller coaster with chasing it with lots of insulin, those are typically the people that are going to suffer with more hypoglycemia than those of us low carbing. I'm going to be completely honest with you, because it's a crazy nightmare. If doctors prescribe anything outside of the ADA guidelines and say they have a patient that dies from hypoglycemia or is severely injured because of hypoglycemia, then they can have the pantsuit off of them. So the flip side of that is they are allowed to tell their patients to eat enough carbs to sink a battleship on a daily basis, and that creates organ damage over a number of years from chronic elevated blood sugar, and that's considered okay in their eyes. But it's not okay in my eyes, because I would like to keep my eyesight, I would like to keep my kidney function, I would like to keep all of my toes and my legs, and I don't want to have gastroparesis or neuropathy. I don't want obesity, and I definitely don't want heart disease. So pick your poison. Carbohydrates are all of those lovely things that I just listed, and I'm just gonna get rid of the bread, but that's my opinion. So here's why advocating a lot of carbs for people with diabetes, type 1 or type 2, is freaking stupid. Telling somebody with diabetes to eat a lot of carbs is kind of like telling somebody that's allergic to peanut butter just to eat peanut butter every day and you'll be okay. No, they won't. They will die. They'll just die a lot quicker than we will eating carbs. Diabetics have a metabolic condition where they can't metabolize carbohydrate correctly. So why would you tell us to eat a slew of them with every single meal? Anybody seeing the problem here? Is it just me? It seems like common sense. It really does. So just a little background history. Before there was insulin and they knew people would die from type 1 diabetes, it was just a matter of time. You know how they kept them alive longer? They fed them a low-carb ketogenic diet. Hello? Are the light bulbs going off for anybody else but me? So blood sugar over 140 actually causes cellular damage. There are studies on this. Feel free to use a wonderful tool that is spelled Google. You can find lots of information there. I'm not going to go into all that. So the next fact is that non-diabetics have an A1C in the upper 4s to the very low 5s at max. So why is it safe then for diabetics like me to literally have double the normal blood sugar value? That's a little food for thought. How does that make sense? So then we throw pregnancy into the mix of all of this, and we know, if we know that elevated blood sugar causes cellular damage, why do doctors think that elevated blood sugar during pregnancy is okay for a developing fetus? It's not. It's not. So there are huge risks from elevated blood sugar during pregnancy, miscarriage, stillbirth. You could have high blood pressure and develop preeclampsia. You could have early birth. You have a high C-section rate because you have huge, ginormous babies because they have been overfed with the high blood sugar throughout the whole pregnancy. Birth defects like heart problems, spinal cord, and other organs. And so also during the first trimester, like if you're not very well controlled when everything's developing, you can end up with a lot of organ damage to the fetus. And most people don't realize in the first trimester, well, some people, like for 8 weeks, that they're pregnant. So that's why it's super important to have your blood sugars in check, no matter what's going on. Because, I mean, really, if you're a woman in childbearing age, like, and you're having sex, like, let's get real, it could happen. So let's just be cautious about that. The doctors tell us to eat more carbs, inject more insulin, which causes more weight gain. And like, then we're going to be riding this roller coaster with our blood sugars. It increases all of these other risk factors. We're having these violent swings with our blood sugars, which isn't good for mama or baby. So seriously, there's like no common sense being used. So non-diabetic moms have an average blood sugar of 65 milligrams per deciliter, but doctors tell diabetic moms it's okay to have an A1C in the 6s, which equates anywhere from 136 to 172 milligrams per deciliter. Hello? That's not a good idea. It's just not. So a lot of moms are scared by their doctors because the doctors start telling them how horrible ketones are and that their babies are going to starve and their brains are like not going to develop. And I'm calling the BS card on this one because babies, every single one of us, every single one of you watching this, when you were born, when your babies were born, they came into this world running on ketones, because ketones are our body's preferred fuel source. Fat is our preferred fuel source. There have been studies done on pregnant pigs and their little piglets, because pigs are the closest to us anatomically speaking to study. And they found that the ketogenic pigs, the fetuses of those, had increased fetal brain weight and development. So we don't need to worry about the brain thing. So eating low carb usually means that you're probably eating better than 75% of the expectant moms out there anyway, if you're doing it correctly. Like I have said in other videos, there's a very wrong way to do low carb, which consists of, let me just drink Atkins shakes and eat those bars, and I'm, just gonna live on nuts and cheese. There are things called vegetables, and you should eat them too. I'm just putting it out there. A lot of moms use pregnancy as a time to just binge on whatever the hell they feel like eating. This is not the time to do that, especially if you have diabetes. Trust me, I have had visions of donuts dancing in my head for 19 weeks, and I still haven't had a damn donut. So you can do this, okay? If you're eating low carb, you're going to be eating the right way. Quality meats and fats and lots of veggies and lots of nutrient-dense foods. So it's a win-win, okay? The other thing that doctors are not telling these moms, as they're scaring the piss out of them and saying that your baby isn't going to develop a brain, is a very long word called gluconeogenesis. Gluconeogenesis. There's that tool you can use, GOOGLE, and get more information about that. But basically, it's the capacity for your body to convert other macronutrients besides carbs, so that's fat and protein, into glucose. So did the doctor tell anybody that one? Did they tell you that your body has the ability to create glucose? Probably not, because they just want to scare you into eating the recommended daily amount of carbohydrates of like 60% or some crazy crap like that. So have you ever noticed, for my diabetics out there, you can eat an all protein meal, but you still see your blood sugar go up a few hours later. Your body breaks down a third of your protein into glucose anyway. So trust me, your baby is getting glucose. You are getting glucose. You're not going to die. You're not. Your baby's going to develop. It is going to have what it needs. So here's another reason that telling type 1s to eat carbs during pregnancy is really dumb. Insulin resistance. Now, insulin resistance happens to all women, but to people with type 1, it's like, wham, bam, thank you, ma'am. Like, it is beyond insane. And it happens because our placenta releases all of these lovely anti-insulin hormones, but insulin resistance is an evolutionary adaptation process that has happened so that there is a flow of nutrients to the fetus. Because if we stayed super insulin sensitive, then we would be utilizing all of the nutrients and they would not be flowing to the baby. So it essentially pushes nutrients to your baby. So if we're already insulin resistant, we're having to increase the amount of insulin that we need to keep our blood sugars under control. Why the hell are they telling us to eat a slew of carbs? It doesn't work. It does not work. So at this point in our time together, does anybody have any questions? Did I lose anyone? Are you asleep? There will be a test at the end. No, there's not actually going to be a test, but I do have an announcement, so stay tuned. So my experience with low carb and pregnancy didn't quite go as expected at the beginning. I thought I was going to be one of these women, like hardcore balls to the walls. I'm doing this thing, but when nausea hits and all your body wants is goldfish, graham crackers, like Teddy Grahams and wonton soup, it wasn't the best experience for about a week and a half there. But once I got past that, it was smooth sailing, okay? I will tell you that every suggestion the doctor gave me did not touch the nausea. I was one of those very lucky ladies that had it extremely bad. But however, after like that week and a half of feeling like crap and I got back on my low carb bandwagon, I do eat about 60 grams a day most days. It has meant more stable blood sugar. a lot less lows, a lot less crazy swings, and a better A1C. So today I had my A1C tested, excuse me. When I started my pregnancy, actually, I was at 5.7. I had been bouncing between 5.5 and 5.7, and today it was 5.4. So even though there are days where type 1 in pregnancy is extremely hard, even on low carb, I'm not saying that it's a free pass or an easy ride if you choose to do low carb in pregnancy, but what I am saying is it is a more stable ride. And I will say, like, I still have days that suck, but overall, seeing that number today I know that I'm giving myself and I'm giving my baby the best chance to be as healthy as possible. One thing that I do know is as my insulin resistance increases, which it will, unfortunately, my carbs will decrease less than they are now. It's just going to happen. So what I can tell all of my friends watching this, and I hope that you will share this with somebody that you know that can use this information, I want you guys to find a doctor that will support you, one that understands the difference between diabetic ketoacidosis and nutritional ketosis, because they're different things. Find one that or who knows that telling you to eat carbs is like telling somebody that's allergic to peanut butter to eat peanut butter every day. Do your own research. Remember that doctors are advisors. They are not God. They practice medicine. It's not perfected. And be your own advocate, okay? You guys have to use your brain. You have to use common sense. You have to use your intuition and your gut feeling because it's there for a reason. Don't be afraid to ask questions, and don't be afraid to get opinions from other medical professionals, okay? So that's what I have. Oh, there's a bee. That's what I have for you lovely people tonight. But with that said, please don't forget, man, that bee just likes me. Please don't forget that the Low Carb Academy is starting on August 22nd. So for those of you that want to learn how to do low carb the right way, the healthy way, how to use it as a healing mechanism and to embrace it as a lifestyle, come and join me. I would love to have you. I am doing free 20-minute consults right now, and if you want to snag one, I will make sure to leave the link below in the comments, so you will see that and you can just pick what time is going to work best for you. So I'm going to get off of here because I'm sure some of you want to go watch like the opening ceremony for the Olympics and that kind of stuff, and you probably have other things to do on Friday night. So I appreciate your time and that you have taken it to spend with me and to learn and be educated. If you guys have any more questions, leave them below, and I will be back tomorrow. Talk to you guys later.